Doctor, I would assume that you see patients who have tried traditional therapies and they have
Yes.
not worked. How much more of a challenge is that, assuming their immune system, their body has broken down a little bit from those treatments? How much of a challenge is that to get patients like that are sicker than they normally would be?
Yeah, imagine, Scott, the challenge that we do have
Mm-hmm.
for the reasons you just mentioned, right? I mean, we see patients not when they're recently diagnosed or in
Right.
stage 1, 2, or 3. Typically, we see them when they've tried everything.
Mm-hmm.
So there were some studies done in Russia where someone that has had chemotherapy, they're at least 6 months behind in immune function, right?
Mm.
And then you look at the emotional component of not having hair, for example,
Mm-hmm.
or feeling weak or vomiting or diarrhea, as a consequence of the chemo. So it's quite a challenge, and my prayer and my hope every day is to see patients earlier, right?
Mm-hmm.
Where we can really make a big impact in a body that's not so suppressed and toxic, and a spirit and a soul that's not so down and depressed. So it's a big challenge, but that's what we do, and we have a great staff and a loving, caring staff that will go the extra mile, as they say, to
Mm-hmm.
comfort and love and care for the patient. So, and that's what it's all about, because a lot of patients that come to us, they really don't even have love in their life, and so it's important to look at the whole individual,
Mm-hmm.
and hopefully they can learn enough that when they go home, then they can do the right things, right? Oftentimes, patients call us and they say, I stopped a diet or I stopped this, and that's when I'm like, oh, why?
Mm-hmm.
And so in the last year or so, we've developed a very, very precise aftercare program where we have the patients, prior to them being discharged, after a 2-3 week stay at our clinic, we give them in writing the day and the time that our aftercare consultant will call them. So they know when to
Mm-hmm.
expect a call from us, and that's on a weekly basis or as needed. And of course, emails are always available. So
Mm-hmm.
until we upgraded the aftercare program, it made such a difference, because now, more so than ever, we're there with the patient, because we know that in 2-3 weeks you could only achieve so much,
Sure.
right? But the big work comes when they're back home, where they have to cook for themselves, they have
Mm-hmm.
to take their own treatment and so forth.
Right.
So it's a big part, and we're really proud at Hope for Cancer